So let's start. Why IHD I have taken? Because it was very close to when I began practice that I got this case. So I wanted to share with you. Normally we think very difficult cases, we don't take in early practice. But again I must tell you that it was accidental. What happened that time, I was with on the college, I was involved with the college, and I was editing the Indian Journal of Homeopathic Medicine, which used to be published by the CMP college earlier. So again by accident I had been told you have to do this job. I will be editor. I said, hello, I don't know anything about it. I have been in practice from some 2 years or whatever. And they said, no, it's not anything, you will do it. So I did it, and anyway we did all right. But from that it came about that the person who used to publish the journal for us, print it, he told me that next week, next issue is going to be difficult. I am going abroad to do a bypass surgery. So I told him, no, homeopathy is very good. You don't go, you take my medicine. Then when you have some 1 week, 2 weeks, whatever before you go, that much time at least you take. If you improve, fine. If you don't improve also, you are still going. So that is how he was to go to Houston for bypass. I told him to take homeopathy. He improved and he lived for 10 years after that without any surgery. And when he died also, it was 10 years later, and due to his food, he had become by then, thinking very strong, now nothing can happen to me. He got another attack, and everybody knows today, so we say just where you are, lie down. If you can just do that, you can conserve. He is going to hospital, being the strong man he thinks he is, he said, no, I will not take wheelchair, and he walked. So it, anyway, and he told me only one dream of his was left unfulfilled. He wanted to start a old people's home. By then he had gone into lot of social activities, where people can live, and that time this was still some time ago, so it was not common. Today lots of old people, nice homes are coming up where you can buy a flat and stay, where you have all the things done for you. So it is much easier, but you still don't have that thing of how somebody will look after you. You can even buy your own person, you can employ a person to caretake, or the facilities are there. But the idea is that you have facilities all of it. Okay, so this started me on this project. I have a trial cases of 67, and the whole thing I want to talk about IHD is that like this man, like this patient, we must not think that we can do everything. Lot of homeopaths, especially I suppose when you are much younger and very enthusiastic, or you are a lay homeopath, you think you can do everything with homeopathy. As you become older, you see that you cannot do everything, and we should do only what we can do. Because I am saying this strongly because lots of time, lots of homeopaths tell people stop your medications, and then they can have a cardiac crisis, they can have a diabetic crisis. You cannot do it. As they improve, maybe you can taper off the drugs in conjunction with the specialist, whoever. It is always nicer to do it that way. And today doctors have also become much more cooperative in that way, not like when we initially began practice. I like to say we did a lot of work, and therefore the world has changed. Our batch has actually, our 1 or 2 batches have done lots and have been instrumental in a lot of changes that have happened. So do not withdraw all allopathic drugs immediately. Taper off under expert supervision. Homeopathy given diligently and with precision gives a nice almost 60 to 80% results. So this was a 68. He had atypical angina. What is atypical angina? Where the symptoms are not as classically described. Okay. Today we see more atypical than that. We also then do a little bit about this thing, angina. So pain he had in the jaw to the shoulder, arm to the hand. It used to be severe pain once in 15 days, worse after bath, worse after exertion, worse after stool. Why is that? Why are these common things? Yeah, because you do not realize, we are doing it every day and we do not realize the amount of exertion you do when you strain at stool. His cardiac test was strongly positive. ECG, it was enlarged, showed enlarged heart. Diagnosis was unstable angina after inferolateral wall ischemia in 1975, and he was advised coronary bypass. Okay, we'll for a minute we'll go back and let us do understand angina. How many of you can have some knowledge of what are the basic classical symptoms and why is that? Yes, it is an attack. The blood supply is compromised at that time, and if you take complete rest, as I was telling you earlier, that if you can just lie down where you are, then it is able to deal with that much less requirement, and you may find that the ECG comes out normal after that. Sometimes it presents just with breathlessness. So you may be walking your normal walk and you get breathless. If you are doing unaccustomed exertion, anybody can get breathless. Sometimes you say while talking I am getting breathless. So you have to figure out whether the patient is, got something, and then you have to go into detailed history of since when, how long, all that. If it is longer time, it may be asthma. So you will have to differentiate. Get syncopal attack. What are syncopal attacks? Correct. So why is that again? Yeah. So when does that happen? Can you describe it? No, it is lack of blood supply. No, what happens typically is that you are lying down, you are okay, you get up. You've had some breathlessness, you want to get up, you stand up and you faint. So it is that blood supply is not enough when you get up. It was enough when you were lying down. Or it can happen that there is a severe straining at stool and that time you had that. You've had a good orgasm, good sex, and you get up, the man gets up and the blood supply is not enough, he falls down in a faint. So, and then as you rightly said, he can immediately, because that supply is enough at that time when he is lying down, the attack finishes and he can get up and wonder what happened. Because of all these things is why it is always, people will take off this first attack as saying कुछ gas हो गया, कुछ acid हो गया, अभी तो चला गया. Anything which has gone away, you think it is not so serious. That may be true in general, but not true for angina. Palpitations, sudden, gets up in the morning with sudden swelling of face and feet. Okay, and of course you can have GI symptoms, both you can have diarrhea and you can have vomiting. There may be just, we have our medicines always described as very sharp pain, shooting pain. You may have none of these. You may just have discomfort, a sensation of suffocation or unease.